Okay, bonjour, et merci de vous être joint à nous
Hello,
aujourd'hui.
and thank you for joining us
Today, we
today.
will hear from Canada's Chief Public Health Officer, Dr. Theresa Tam, the Deputy Chief Public Health Officer, Dr. Howard New, et le ministre des Transports, M.
And the
Marc
Minister of
Garneau,
Transportation,
sur
Mr. Marc Garneau,
teleconférence.
by
Dr. Tam,
teleconference. Dr. Tam, please.
Good afternoon, bonjour. I will start with the latest numbers on COVID-19 in Canada. There are now 92,748 confirmed cases, including 7,414 deaths. And 50,684, or 55%, have now recovered. Labs across Canada have tested over 1,751,000 people for COVID-19 to date, with about 5% of these testing positive overall. Over the past week, we have been testing an average of close to 29,000 people daily. As more and more restrictions are relaxed, places are reopening, and as the weather warms, we should all be feeling better, right? But this is not necessarily the case for many of us. Some still have concerns about being at higher risk for COVID-19 of severe outcomes, and we may have anxiety about going into public places where it isn't easy to keep our physical distance. The reality is we have adapted staying at home into our daily routines over the weeks and months of the COVID-19 epidemic, and it has now become our habit. Some habits that we've developed, like more frequent hand washing and spending more time with our families, can be good things that we'll want to carry on with going forward. Other habits, like increasing alcohol consumption and not being as physically active as before, are clearly not so healthy, and we'll really need to put the effort in to replace these changes with healthier routines. The fact is, adapting to change is hard. And once we've made a change, it can be hard to go back to previous healthy habits. Some have compared this with reverse culture shock. Whatever it is, the discomfort and inertia we feel is real. Once we form the habit, it seems easier and less discomforting to just stick with the new routine. But whenever a new habit is having a negative impact, whether on our mental, physical, or social well-being or otherwise, it's time to make a change for the better. I want people to know that if you are struggling with concerns big or small, there is help and there are helpers, more than you know. Taking the next step can be as easy as deciding to talk to someone close to you. And if you don't have someone nearby, there are virtual resources available, such as the Wellness Together Canada portal, which includes a suite of tools that offer different levels of support to people depending on their needs. Available resources range from information and self-assessment tools to the opportunity to chat with peer support workers and other mental health professionals. Don't forget, when the sun is shining and you're ready to step out, you can wrap yourself in layers of effective public health protection to stay safe. Physical distancing, hand washing, and cough etiquette, topped up with a non-medical mask or face covering for when you can't keep your 2-meter distance from others. Thank you. Merci.
Thank you, Dr. Tam. Et maintenant, je donne la parole à Dr. Howard.
And now I give the floor to Dr. Howard New. Dr. New, please. Thank you. Good afternoon. I will start with the latest numbers on COVID-19 in Canada. There are now 92,748 confirmed cases, including 7,414 deaths. 50,684 people have recovered, which is 55%. Throughout Canada, labs have tested over 1,751,000 people. Approximately 5% of them tested positive. Over the last week, we have tested an average of 29,000 people a day. As more restrictions are relaxed, places are reopening, and as the weather warms, we should all be feeling better, no? But that's not necessarily the case for many of us. Some are still concerned about being at risk of COVID-19 severe outcomes. We may have anxiety about going into public places where it isn't easy to keep our physical distance. The reality is we have adapted to staying at home. We've included it in our daily routines over the weeks and months of the COVID-19 epidemic, and it has now become our habit. Some habits that we've developed, like more frequent hand washing and spending more time with our families, can be good things. Those are the habits that we'll want to carry on with. Other habits, like increasing alcohol consumption and not being as physically active as before, are clearly not so healthy. We'll really need to put the effort in to replace these changes with healthier routines. The fact is, adapting to change is hard. And once we've made a change, it can be hard to go back to previous healthy habits. Some have compared this to a reverse culture shock. Regardless, the discomfort and the inertia we feel are very real. When we've formed a new habit, it seems easier and less discomforting just to stick with the new routine. But whenever a new habit is having a negative impact, whether on our mental, physical, or social well-being, or otherwise, it's time to make a change for the better. I want you to know that if you are struggling with concerns big or small, there is help and there are helpers, more than you know. Taking the next step can be as easy as deciding to talk to someone close to you. If you don't have someone nearby, there are virtual resources available, such as the Wellness Together Canada portal, which includes a suite of tools that offer different levels of support to people depending on their needs. Available resources range from information and self-assessment tools to the opportunity to chat with peer support workers and other mental health professionals. Don't forget, when the sun is shining and you're ready to step out, you can wrap yourself in layers of effective public health protection to stay safe, including physical distancing, hand washing, cough etiquette, as well as wearing a non-medical mask or face covering when you can't keep your 2-meter distance from others. Thank you.
Merci, Dr.
Thank you, Dr. New. I will now give the floor to the Minister of Transport, Marc Garneau. Marc, please.
Good afternoon. Bonjour. Frontline workers have been vital in Canada throughout the COVID-19 pandemic. While many people stayed home or switched to working from home, many people could not. This includes many who work in the transportation sector. J'aimerais remercier tous les intervenants du secteur des transports.
I would like to thank all the stakeholders of the transportation sector who have followed up on the many protection measures I've announced in the past. However, despite many new precautions and measures taken, there are still areas of the transport network where workers need to be closer than 2 meters to their colleagues or fellow travelers.
Coverings for workers and others involved in the transportation system to help reduce the risk of COVID-19. For aviation, effective Thursday, June the 4th, existing requirements for face coverings for passengers will extend to flight crews and also airport workers in the restricted area of a terminal when they are not able to physically distance. Due to safety concerns, an exception is being made for pilots who are not required to wear face coverings while on the flight deck. À compter de jeudi, le 4 juin à midi,
effective noon Thursday, June 4th, existing requirements for face coverings for passengers will extend to flight crews and to airport workers when they are not able to physically distance. Due to safety concerns, an exception is being made for pilots who are not required to wear face coverings while on the flight deck.
Recommending that all workers have a face covering to be worn when physical distancing cannot be maintained and when they are required by local authorities. We're also recommending that rail operators make face coverings available for all workers. Keeping safety in mind, they should also ensure that workers, when possible, wear face coverings. Rail operators are also requested to ask passengers to wear a face covering when physical distancing cannot be maintained. Pour ce qui est des travailleurs du transport routier,
as for road transportation workers, a set of practices will soon be established for the use of personal protective equipment and face coverings in order to protect both workers and passengers. These practices have been developed by working with provinces, territories, and industry. They will apply to those who work in the trucking, bus, and transit sectors.
It's important to keep in mind that physical distancing of at least 2 meters, frequent hand washing, and other public health and hygiene practices are still the most effective methods to limit the spread of the virus. And the Government of Canada continues to recommend that all Canadians limit non-essential travel. The measures announced today will better protect everyone involved in the transportation system: passengers, support workers, customers, and essential transportation workers who continue to do incredible work ensuring our transportation system continues to function. Our highest priority remains Canadian safety and security. Face coverings for travelers and transportation workers are yet another measure in our multi-layered approach to help limit the spread of COVID-19. Thank you.
Okay, thank you very much, Marc. On est prête maintenant à répondre à vos questions.
We're now ready to take your questions. Thank you to the Deputy Prime Minister.
One question, one follow-up, and then we will turn to the room. Operator, over to you.
Thank you. Merci. Our first question, notre première question est from Hélène Bizetti avec Le Devoir. Please go ahead. À vous la parole.
Oui, bonjour. Ma question serait pour la ministre
From Le Devoir,
Freeland.
my question is for Deputy Minister Freeland. Great Britain has announced more flexibility for migration for people from Hong Kong. I'm wondering if Canada is considering something similar. Answer. Thank you for the question. Canada is a country that warmly welcomes immigrants. We are proud of that. That's one of the reasons that we have such strengths as a country. Immigrants from Hong Kong, in particular, have played a very important role and continue to play a very important role in our country. I think that all Canadians appreciate the role that they've played. Canada will continue to be a country that welcomes immigrants and asylum seekers from around the world. I also wish to highlight that today there's about 30,000 Canadians in Hong Kong. And Canadians in Hong Kong today will be warmly welcomed here. This is their home, and they always have the right to come home to Canada. Thank you.
Canada, excusez-moi, je vais répéter la réponse.
Sorry, I'll repeat the answer in English, if I may.
Oui.
Canada is a country that welcomes immigrants, and that is a source of great pride and a source of real strength for our country. The community in Canada of people who have immigrated from Hong Kong and their children and grandchildren is a really, really important community in our country. And I know that we all appreciate the contributions that Hong Kong Canadians have made and continue to make to our society every single day. Canada continues to be a country that welcomes immigrants and asylum seekers from around the world. And of course, in particular, when it comes to Hong Kong, there are roughly 300,000 Canadians currently living in Hong Kong. All of those people are Canadian. And of course, dear Canadians living in Hong Kong, you are very, very welcome to come home anytime. Thank you.
Oui. Et en supplémentaire, j'aimerais revenir sur la question des
Follow-up
annexions
question.
de territoire
I'd
par
like to come back
Israël. Vous
to
avez
the
des,
annexation of
des
territory
anciens
by Israel.
diplomates et des anciens ministres
Former
qui vous ont demandé
diplomats
de
and
dénoncer
former
les
ministers
intentions
have
d'Israël plus
criticized
vigoureusement.
Israel's intentions and have asked you to denounce them more vigorously. Mr. Trudeau
Mais ces gens-là disent que ce
briefly
n'est pas
touched on it
suffisant
yesterday,
et que le Canada
but
devrait
others
faire un
think
peu
that this
comme
is
ce qu'il
insufficient
avait
and that
fait dans le cas de
Canada
l'annexion de la Crimée
should
par la
do
Russie
more.
et qu'il
For instance, the
initie
way it
un
reacted
mouvement
to Russia's
international pour non
annexation of
seulement dénoncer,
Crimea.
mais créer un mouvement qui amènerait Israël
A
à
movement should be
abandonner son projet.
created
Alors,
to
j'aimerais
convince
savoir,
Israel not
puisque
to
vous
do
avez été une
this.
de celles qui était très active sur la Crimée,
As someone who was very active in the Crimea
lancer un
file,
quelconque mouvement
do you
pour
think
faire en
that
sorte qu'Israël n'annexe pas les
something will be
territoires comme la
done
vallée de Jourdain?
so that Israel does not annex other territories like the Valley of Jordan? Answer. The Prime Minister was very clear about that particular issue. He had conversations with the main leaders in Israel. Canada's position has been a long-standing one on this issue. The position has not changed, and the Prime Minister and the government will continue to support this position very clearly. Thank you.
Merci, Madame la Première Ministre. Operator, next question, please.
Thank you. Merci. Our next question, notre prochaine question is from Stephanie Levitz with the Canadian Press. Please go ahead. À vous la parole.
Good afternoon. Thank you for taking our questions. My first one is for Dr. Tam. I wondered if I could ask you about your assessment of vaccine research progress in Canada, given that Britain and the U.S. are now both promising big rollouts of hundreds of millions of doses as early as this fall or 2021. I'm just wondering, what's your sense of how we're doing to produce something here at home or making sure we have enough from overseas?
So I think vaccine research and development is very much an international effort, and this is an incredible amount of work with, as far as I know, well over 100 candidates that are currently being investigated at various stages. So it is very encouraging to see some of the international trials going ahead. And we do have some of this clinical vaccine development going on in Canada. Some of them are still at a preclinical stage. But I think, as we had highlighted a little earlier on, there is one clinical trial that was starting in Canada in phase 1. So again, we're making all efforts, not just on the research end and the clinical trial end. The clinical trials are very important because you need to establish safety, the dosing, and the effectiveness of the vaccine. So it is a bit of a rigorous process at the same time as we want to accelerate the development. So that is definitely, we're part of the global effort. But we're also, of course, looking at beyond the research and the clinical trials to look at the actual capacity for vaccine development and manufacturing, all the way to getting equipment ready for the time should we have a vaccine. So I think that Minister Anand had talked about syringes and all of that. So we're looking at the whole suite of measures right now.
Stephanie, follow-up?
Yes, thanks. My follow-up is for Deputy Prime Minister Freeland. Earlier this morning, the NDP leader Jagmeet Singh said that in failing to stand up to Trump, to outwardly condemn some of the things he has said in recent days, that's to be complicit with him. What's your response to that?
Thank you very much for the question, Stephanie. Look, I think that the most important response of any Canadian political leader has to be to understand our own responsibility for what happens here in our own country. I think our most important response has to be to not be complacent about racism in Canada, to be very clear that anti-Black discrimination is real here in Canada, to be very clear that systemic discrimination is here and is real in Canada, and to be very clear that unconscious bias is here and is real in Canada, and to be clear that we as a country have to work really, really hard to fight anti-Black racism and all racism in our country. And really, critically, to realize this is a problem for us and to think about and to work on what we need to do to fix it and to listen really hard to the voices of racialized and Black Canadians.
Thank you, Deputy Prime Minister. Operator, next question, please.
Thank you. Merci. Next question. Notre prochaine question, je comme Lina Dib avec la presse canadienne. Please go ahead. À vous la parole.
Question from the Canadian press. Yes, Ms. Freeland, I'd like to stay with that same topic. I've heard several times the word Canada in your answer. I think the question is about what's happening in the United States and the silence of Mr. Trudeau that was reported around the world. As Deputy Prime Minister, do you think Mr. Trudeau's silence was a message? Do you think it was calculated? Is there a message from the Government of Canada in that silence? Or was it simply spontaneous? Answer. I think the answer from the Prime Minister yesterday was eloquent and excellent. Thank you.
I think that, excusez-moi, Lina, je vais...
Sorry, Lina. I'm just going to repeat that in English.
I think the Prime Minister's answer yesterday was excellent and it was eloquent.
Lina, en suivi.
D'accord. Et donc, dans ma
Follow up?
suivi, dans sa réponse, vous incluez le silence?
In his answer, you include the silence. Answer. The answer of the Prime Minister was the answer of the Prime Minister.
Thank you, Deputy Prime Minister. We'll now turn to the room, starting with Crystal from Global.
Hi, my question is for the Deputy Prime Minister. A growing number of Canadians, including the National Institute on Aging, are calling for your government to include long-term care under the Canada Health Act, to force full reporting and information from provinces and territories, and accountability for how the federal health care dollars are spent. What, if any, consideration are you giving to doing this?
Thanks for the question, Crystal. And I think that all Canadians are rightly very concerned about what we have learned has been happening in some long-term care facilities in Canada. And I want to take a moment to thank the amazing women and men of the Canadian Armed Forces who are literally saving lives every day and whose report, I believe, will turn out to be a historic document and really draw our attention to some of the problems there. We are committed to working very hard and closely with the provinces and territories to really profoundly transform long-term care in Canada. What we have learned has been happening cannot continue. We have to make it better, and we will. We also really believe that it's important to do this work in close collaboration with the provinces. It does fall under their jurisdiction. And I do want to say, one of the strengths that Canada has had thus far in response to the coronavirus crisis is we've found a way to all work together, including the federal government and the provinces and territories. And that's something that we're committed to continuing to do.
My next question is also for the Deputy Prime Minister. Jagmeet Singh is calling for some specific measures to combat racism, legislation to end racial profiling in the CBSA, CSIS, and the RCMP, and some kind of action to end over-incarceration and criminalization of Black and Indigenous people. Are those things your government is prepared to do? And if not, what specific steps are you prepared to take?
I do think that it is really important for us to take this moment to look specifically at what we as a country and what we as a government can continue to do to combat racism, to combat anti-Black racism. You asked specifically about police, and let me just say that there can't be any tolerance for racism or bias in any police force in Canada. Racial profiling is unacceptable. And our government is absolutely committed to upholding the Canadian Charter of Rights.
Thank you. Bruce?
Hi, just maybe a follow-up. Bruce Campion-Smith, the Toronto Star, just to follow up with that, Deputy Prime Minister. We have heard rightly strong condemnations of discrimination, racism, and these unconscious biases, but I'm not sure words alone will fix it. So I'm just wondering, will the government choose this moment to lay out some action, to act in the spheres it can to reduce these incidents? And if so, what?
Well, first of all, let me say congratulations, Bruce, on your upcoming move. And when it comes to racism in Canada, anti-Black racism, but I think the coronavirus has also drawn our attention to racism against people of Asian descent. We have to take it seriously in our country. I do think that there is more that we need to do as a country and as a government, and we will be acting. We'll have more to say about this.
Okay. Dr. Tam?
And I do also, I'll say one other thing about it, which is I just really would point to the really important work that Minister Bardish Chagger has been doing and continues to do on this issue. Sorry.
Question maybe to Dr. Tam. Work is underway on the vaccination, of course, but I assume as well work's underway to just improve treatments. And I'm just wondering whether over the course of the coronavirus, whether you've seen a change in mortality rates as, doctors and health staff have gotten better at understanding kind of the progression of the disease and how to treat it.
Yes, so I think there's some pulling together of international data on clinical management. And certainly the intensive care networks have been sort of working together to look at the more details on intensive care itself, because for the most part, right now it's supportive care, given that there's no actual specific antivirals or other treatments. So I think there's progress on that front, but I can't comment it because I'm not an intensive care specialist, but I know that that information is being pulled together. The understanding of the science behind the clinical spectrum, as well as the underlying pathology, if you like, is evolving. So I think there's some increasing understanding of the inflammatory response. And some of these, the kids we talked about a little bit with the multisystem inflammatory syndrome, where treatments such as the traditional ones for Kawasaki disease, like intravenous immunoglobulin, seems to work as well. And then more research is now going on about the virus's role in vascular disease. So I think all of that will result in a growing body of evidence, but it's a very, very active, not just domestic, but international body of research. So I can't say whether that has impacted the morbidity, mortality over time as yet. Most of the Canadian mortality, as we all know, are now really related, at 82% to long-term care homes.
Thank you, Doctor. Back.
Hi, Mr. Freeland. Mackenzie Gray from CTV News. There's a video that's been circulating online from Cape Dorset, Nunavut. An RCMP officer hit a man who appeared to be drunk with his car. He opened the door and hit him. He then arrested him on the ground with 5 of his other colleagues while onlookers filmed this. I don't know if you've had the opportunity to see the video, so if you haven't, that's fine. But one of the things that the MP for Nunavut, NDP MP, has brought up is the idea that if police officers had body cameras on in these situations and other situations up north where the RCMP has been involved in an arrest, they would have a better understanding about what happened and they'd be able to get to the bottom of things better. Is that something that the government is considering mandating the RCMP to do?
Well, thanks for the question, Mackenzie. And I haven't seen the video that you mentioned, so I can't comment on it specifically. What I can say is that, of course, the RCMP do an important, essential job in our country, and I think we're all very grateful to them for protecting us. Any instance of police brutality or mistreatment of Canadians is completely unacceptable. And, I think our country is today particularly aware of and concerned about racist behavior by police officers, and it's right for us to be concerned about that. And that, of course, is entirely unacceptable by any police force in Canada, very much including the RCMP. And I do think that this is a moment when all of us in our country need to reflect on both what we are doing and specific measures and steps we can take to fight racism.
You've spoken, the Prime Minister's spoken, many cabinet ministers have spoken about being an ally, the importance of fighting and combating anti-Black racism. The steps that many regular Canadians are taking is protesting, doing things online to show their solidarity with their fellow Canadians. There are many protests planned for this weekend, including here in Ottawa and Toronto. Are you planning on attending any of them?
That's a good question, Mackenzie. And in my day, I have gone to quite a few protests. My mother was a pioneering feminist in Alberta, so Take Back the Night marches were a familiar form of childhood activity for me. And I think it's a good question and something for all Canadian leaders to think about. One thing that I will say to people protesting in Canada is peaceful protest is a valued and important and really useful form of political expression. It's a way that you as a citizen show your commitment to your society. I think Dr. Tam has offered some advice earlier this week about protesting in the age of coronavirus, because there's obviously a concern where when we are advising against any large groups getting together, a protest by definition is a group of people getting together. And I think it's also something we all need to be concerned about. And I would say, as Dr. Tam has already said, really important also to realize the coronavirus is still here, important to wear masks, important to have sanitizer, and really to take those health precautions seriously. It hasn't gone away.
So you're going to go or you're not going to go?
I mean, the coronavirus issue is a really serious one also to think about in that context. And I will just say, as a mother, I have been struggling very hard to say to my children that they can't see their friends and they can't be in groups. And so setting an example on that front is also an important one for me.
Thank you, Deputy Prime Minister. Mackenzie will let that slide in memory of Julie Van Dusen. We'll take one last question on the phone. Operator?
Thank you. Merci. Our next question, notre prochaine question is from Mélanie Marquis avec La Presse. Please go ahead. À vous la parole.
Mélanie Marquis from La Presse. My question is for Minister Garneau. Why wait a month after having announced the requirement for passengers to wear masks before extending it to flight crews and airport workers?
Merci pour la question.
Answer. Thank you for the question, Melanie. This is a situation that is evolving. We recognize that it's important for passengers to wear masks, and that was announced. I do agree with you that things need to be implemented as quickly as possible. We could have done this a little sooner. The good news is we're doing it now and announcing it today. Follow-up? I'd like to ask you to elaborate on that, Mr. Garneau. What held up acting sooner? Were airlines reticent to implement the recommendations? Answer, no. It was simply a matter of organizing measures in consultation with everybody. It's not simply an issue of speaking with airlines. Announcements made today affect ports, rail companies, provinces, because we're talking about public transit. All of those things take time. I would add that in the case of provinces, it's important to uphold measures taken by public health authorities in the different provinces. Discussions had to take place before coming to a decision. Those things take some time. That is why there was a delay. The good news is we're implementing those measures now. Thank you, Minister. This concludes the press conference for today.